Now, you probably heard about red wine. Well, if you wanted to live longer with red wine, you'd have to drink about 1,000 bottles a day. But I think we're going to give up on that. But there is a substance within this red wine which is called resveratrol. And this has led to MIT and Harvard scientists to undertake very important studies, which could turn out to be quite valuable, because we know that caloric restriction, severe caloric restriction, does produce a longer life. We've known that since the 1930s. The problem is it's not very realistic. The American public could not cut back their calorie intake from 35% from what should be their normal intake, and they're already eating too much anyway. So it's just not realistic. So the goal of these scientists is to find out the mechanism. How do these chemicals that seem to prolong life work? How does it happen? What is the means? Can we create an equivalent drug that would do the same thing? And the beauty of it is that this work demonstrates that not only is age slowed, not stopped, not reversed, but slowed, but at the same time you get a delay in the onset of age-related diseases. And you wouldn't want to just age more slowly but have all these terrible diseases. But here you get 2 for 1. For example, one of the remarkable reasons that people over 65 have lived longer is since 1960 there's been a 60% reduction in deaths from heart disease and stroke. That's remarkable. Unfortunately, we've only had a 5% reduction in deaths from cancer since the war on cancer began in 1971. So we're not doing nearly as well in cancer. And of course we have the huge growth of that awful condition, dementia, specifically Alzheimer's disease. So if we could slow aging, even by 7 years, and delay the onset of diseases, we would remarkably reduce cancer, remarkably reduce Alzheimer's disease. So this is an area I think I return to a little later on the slide, but I think we do have to promote. Next. 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 In addition to the 4 big ones, diet, exercise, no alcohol, moderate, no smoking, there are 2 other things that do seem to contribute to a longer life. One of them I think women do better than men, and that's having a social network, a support system. I think women are much more gifted at intimacy, at sharing their worries and concerns. We men may have the old boy network and help each other get jobs, but I'm not so sure we're very good on the more intimate aspects of life compared to women. And women have more social relationships than we men do in general. Passion or purpose is the other big thing that contributes to a longer life. When we were doing studies as young scientists at the National Institutes of Health in the 1950s and 60s, this came out, and we were very surprised. We were young people. We didn't know what the heck we were doing anyway. But there we were, finding that those older people had a purpose in life, something to get up for in the morning. It didn't have to be a big-time thing, but something that made a difference in their lives. Actually lived longer than those who did not. Next slide. Toughest of all is how you manage stress. I mean, life can be so full of worries and concerns, losses of loved ones, other conditions. But to the degree possible, try any one of these: meditation, visualization, little mini vacations, anything to take some of the pressure out of your life. Thanks. Now, we have no data to prove that the following 3 that you see on the board stops us from getting Alzheimer's disease. But nonetheless, we do know you have to keep your brain healthy, just like you have to keep your body healthy and have your quadriceps or your thigh muscle healthy. You need to have your brain healthy. Intellectual stimulation is very important. Social interaction, friendship, and interestingly, physical activity. Now, the Romans knew that, and they used to write a sound body, a sound mind. So just being physically active, or joining that walking that I suggested earlier, actually appears to help maintain the vibrancy, the vitality of your brain. Next. Also, there are educational opportunities which I would suggest people avail themselves of. There's one group called Lifetime Learning Centers that a philanthropist in San Francisco has set up. It has over 113 of them in the United States at various colleges and universities. He gave them over $1 million each to try to provide opportunities for people over 65 to enjoy educational opportunities. Keeps your mind alive. It's fun. Maybe you didn't have the opportunity when you were younger to have all the education you wish you'd had. Here's a chance to make up. Next. Next. Now let's discuss the big issue. The issue is before this country's dead. Here I'm going to get a little controversial. You may wish you hadn't had me come. Next. In my opinion, the health discussion has not dealt adequately with all the real issues. For example, you really have to have structural reform. You have to have a clear-cut relationship between acute care needs and long-term care needs. Long-term care has hardly been discussed at all. And that's very much related to the grants you have in terms of mental health and other opportunities to deal with all of us as we get older. Second is we've had very little discussion about the training level of our workforce. Now, doctors are not well trained to take care of older people, unfortunately. We have 145 medical schools in the United States. Only 11 have departments of geriatrics in order to be certain that students are properly trained. Now, maybe another 20 or 30 have programs in aging, which is the big step forward since 1975, when the National Institute on Aging began. But it's not where it should be. No one should graduate from medical school. And no one should graduate from any residency program, whatever the specialty, without knowing the special issues that affect older people. You can have a heart attack if you're over 65 and have no chest pain whatsoever. You may be a little confused. If the doctor doesn't know that, he can miss the boat. You can have hyperthyroidism, where ordinarily you're hyperactive, and you can be apathetic. You can have very bad reactions to different conditions of weather in terms of what's called, particularly in a cold climate, what's called accidental hypothermia. You can actually die from cold. So there are many aspects of growing older that doctors really do need to be taught and are not. Only about 20% of doctors have ever been in a nursing home.
You've lost
so
your
their
sound.
knowledge of...
You've lost the sound.
You've lost your sound.
I lost the sound? How? This will be a memorable talk. It's going to be a memorable talk.
It's on again. It's on again.
The lecture I did not hear.
It's on again.
Okay. I don't want to take personal responsibility. So we need a well-trained workforce, and that includes also the paid home health aides, who, by the way, are wonderful people. My own personal experience, they've just been great. They're often immigrants, they're often poor, minority people. They have big hearts, they work hard. It's not an easy job taking care of someone. They're cleaning their body parts, changing their diapers, providing their food, providing their medications. It's a tough job. And we have not given them adequate training to best do this. The truth is that doctors and hospitals do not make money keeping you healthy. They make money when you're sick. So we have to change the perverse incentives and deal with the true health promotion and disease prevention. And I think more and more that has to be a public good, a public authority effort, not just the individual doctor-patient. Because today the individual doctor-patient has about 12 minutes to be together. So the chance of any serious discussion about not smoking, or how to exercise your quadriceps or whatever, is not likely to happen.